Hey, future nurses, it's Dr. Nurse Tutor. I wanted to come to you guys with a video, something that struck me when I was teaching in class lecture yesterday. I want to talk to you guys about manifestations. Manifestations are signs and symptoms. The signs, right? The symptoms. One is subjective, one is objective. One is what the patient tells you that they're feeling or going through. Objective, of course, is what you see. Now, why is that important? It is important because it teaches you how to act, and when to move. The reason why that struck me is because when I was going over manifestations with students yesterday, we weren't prioritizing our manifestations. I'm going to give you an example. If a patient is declining on you, when do you act? When is it your priority? For instance, if a patient is starting to decline and you go into the room, when do you want to act and to make a decision to take care of this patient? For instance, you come into the room and your patient has a decline in their level of consciousness. They have decreased level of consciousness, right? Do you want to act when the patient is restless? Do you want to act when the patient is confused? Do you want to act when the patient has stupor? Or do you want to act when the patient has gone into a coma and is unresponsive? All of these things are complications and manifestations. But which one do you want to act on? Because when I was asking my students the manifestations of a particular disease process, as far as the decline, we'll talk about the neurologic system. That's what triggered me. When we were talking about the neurologic system, we were talking about increased intracranial pressure. The patient has increased intracranial pressure. What are the manifestations that the patient is going to present? And my students were great. They were like restlessness, confusion. They'll be thrashing around the bed. They can have stupor. They can have coma. They could be tachycardic. They could be tachypnic. They can also have bradypnea. They can also have bradycardia. So I asked them, well, prioritize that. And they were just like, well, we can act on any one of them. Okay. But which one is going to equal crashing? And which one am I going to be able to turn around effectively? Which one is the patient compensating? And which one is the patient decompensating? Because if the patient is compensating, that's when you want to move. And that's when you want to act on that patient. When the patient is decompensating, now you got to think about that patient going into shock. Now you got to think about that patient probably having to go to the ICU. The exam never, ever, ever wants you to choose an answer. That means you waited too long and your patient is crashing and now they have to go to the ICU. So how do you answer that? If you get an exam question that says your patient has increased intracranial pressure, your patient has congestive heart failure, your patient has a respiratory issue, right? They're all going to start to decline. You want to act on that patient when the body is trying to compensate. What does that mean? I prefer that you choose the answer that says, I'm going to act on this patient when they're restless, as opposed to when they're confused. Why? Because when they're restless, they could still talk to you. When they're confused, that probably means we got carbon dioxide going to this patient's brain, and this patient is becoming acidotic. I want you to act on this patient when the patient is tachypnic and when the patient has tachycardia. Why? Because the heart is beating faster and the patient's breathing faster to try to bring oxygen in and to try to perfuse the body. I don't want you telling me that you're going to act on bradypnea and bradycardia. Why? Because now we have a problem with cardiac output. Now the organs are not being perfused. Now your patient is going to start crashing on you. I don't want you acting on anybody when they have stupor and coma and they're going into a coma. Why? Because this patient is going to be on their way to the ICU. Now you're telling your exam that you waited long enough for your patient to crash. But then my students say, well, Dr. George, all the answers are correct. Yes, but you have to prioritize your answer. That patient can go into a coma. That patient can have stupor. That patient can be confused. But I want you to know enough to tell me I can identify the manifestations early on and act on them early on so I don't have to risk my patient crashing. Because if you have a patient that's restless and tachypnic and has tachycardia, we can turn that around. We could turn that around on the floor. But if you choose an answer that says a manifestation that I'm going to act on is bradypnea and bradycardia and hypotension, yeah, that's not wrong. That is a manifestation. But in the stage of adult health, it's wrong on the exam because it's telling me that you're waiting too long to act on your patient. You have to prioritize everything in your plan of care. When you're prioritizing manifestations and acting on your manifestations, they should be the early ones. This is why your book always will give you manifestations, early signs, manifestations, late signs. Because when we're late and things start to slow down, we are starting to decompensate. The body's shutting down. The organs are shutting down. I never, ever, ever want you to find your patient when they're shutting down. I want you to find your patient when they're fighting and they're compensating. Meaning the respiratory system and the metabolic system are fighting together to try to perfuse the body and to keep the cardiac output normal. Once we start to lose cardiac output and that blood pressure starts to drop on your patient is crashing. And you're telling the exam that the patient is crashing, and that's when you're going to act. You can't do that as a nurse. You never want to do that as a nurse because now you have to call in for reinforcement. Now the ICU has to get involved. Now the doctor's coming to the floor, and then we're going to ask you questions. How, if your patient was alert and oriented when your shift started, how did you manage to get here? How did you go from alert and oriented to bradycardia? How'd you go from alert and oriented to bradypnea? How'd your patient crash and you didn't see that patient in the beginning stages? Because that means you didn't assess your patient. And I know that's not what you want to tell the exam, but I want you to understand when you choose that, you're telling the exam that you waited and you didn't assess that patient to catch the symptoms early on. Don't just choose manifestations because they're correct. Choose manifestations because you prioritize them and you're choosing the early signs to act on. I hope that helped. Choose early manifestations because that's when the patient is compensating, and as nurses, we can turn it around during that stage and the patient doesn't become critical. All right, it's been Dr. Nurse Tutor. I hope that this helped you guys. Exams are coming up, guys. I'm trying to think of everything possible that you're going to be tested on that you're going to have to know. You can have all the right answers in the world, but if you don't prioritize those answers and know when to act to save that patient from crashing, you can't pass the exam. All right, it's been Dr. Nurse Tutor, and I will be back with more videos and more concepts to go over to get you guys through nursing school.